This is the ankle taping video. So first of all, the indications for ankle strapping, obviously if you've just done an ankle injury or you're just recovering from an ankle injury, or you want to prevent your ankles from spraining all the time. Okay, so the first thing you need to do is obviously shave the area. The strapping tape pretty much just sticks to the skin a whole lot easier when there's no hair there. All right. So once you've kind of shaved the ankle, it's super important that you kind of lay on the bed, okay, or the table, and the person helping you strap your ankle puts the foot up against the thigh, because you really want to make sure the ankle's set in the right position before you tape it. Because if we kind of tape it in that position, okay, or inwards, it's kind of the opposite of trying to prevent the ankle from spraining. So it's really important that we set it in the neutral position. So you put it up against the leg there, and when I take my leg away, that should still stay at 90 degrees, okay? So that's important, that stays there. All right, so we get our first bit of strapping tape. It's basically just an anchor. So it goes around the calf, the lower end of the calf. Nothing spectacular with that one, that just needs to go all the way around. It's just an anchor point for the rest of the strapping. Okay, so if we're on the right ankle today, so obviously we want to prevent the ankle from moving inwards. Okay, therefore the tape needs to start from the inside of the ankle and come around this side. Okay, so instruct the patient to kind of keep their foot exactly where it is when I take my leg away. Now, we start from the inside, get the tape quite long, start on the anchor, pat it down so it's all on the skin, and then you take it up to where it hits the anchor, take it off, just reset the ankle just to make sure it's perfect position, and then apply a bit of tension to the taping so it's nice and flat up against the skin, and it's anchored down. Then you've got to repeat that process again, overlapping the tape by half. So now we're starting a little bit higher up, patting it down, make sure it's in contact with the skin, take it up until it hits the anchor, overlapping it by half, apply a little bit of tension. Okay, making sure the patient is always keeping the ankle at 90 degrees. All right. Now the next one is basically we start from the outside of the ankle, like that, and we go to the inside of the ankle, underneath the foot, and then up to the anchor point before. Make sure the ankle's in the right position, reset it, pull on with a bit of tension, lay it flat on the surface. Then you've got to repeat that one more time, overlapping it by half. That all should be covered up. Take it up to the anchor point. Make sure you put the foot up against the thigh. Make sure it's all set properly. Apply a little bit of tension. Make sure it's all anchored down. Keep the foot up against the thigh, and then you just want to do some lock-off tape. So these are quite long. And then just not too tight with these ones. They're not doing anything supportive, they're just holding the tape there so it doesn't come off. Don't do these ones tight at all. You'll stop all the blood circulating into the feet and into the toes, and you'll kind of hinder the healing process. So do about 4 of those. Now, when you finish the ankle, you've done a good job, okay? When the ankle the rear foot, like the forefoot, will bend and twist, that's fine, but it's the rear ankle that won't have any stretch to it. does not move in towards the middle part of the body. It'll move out a little bit, but most ankle sprains are doing that way, okay, and dropping the foot down. So we obviously want to prevent that movement pattern, okay. Now, strapping tape, it's the same with everyone. You want to try and keep it on between 3 and 4 days. If it gets itchy or irritating, make sure you take it off, okay. When you take this particular tape off, you just kind of cut down here or this way and then just peel it off. Give the skin a break for about a day before you reapply it again. And you may need to do that about 3 times in that 15-day period. Okay, thanks for watching.